So given that we are on meniscus today, let's talk about if for whatever reason you lose your meniscus. So it was repairable, or it was repaired and it fails, and you end up not having a meniscus.
And most of the time, I do see this in patients where they had a repair. The repair might have held out for years, but then when you go back in, they've retorn it, and there's really just not very much meniscus left. And so then you really have two options: wait till the arthritis gets bad enough that you need some type of knee replacement, or
Or you can consider doing a meniscus transplant. And the interesting thing is, just because you lose much of your meniscus doesn't even mean that you have to have symptoms. And that's one of the really complicated things with the human body. Just because we see one thing on the MRI scan, for example, a meniscus tear or what we call meniscus deficiency, meaning there's no meniscus left, doesn't mean that you actually have to feel it. And by and large, how you feel drives decisions.
and so in a patient my age, a meniscal transplant is not a great option because it's asking a whole lot to grow into a donor meniscus. It's a long recovery. But in young patients, especially patients in their teens, 20s, and even 30s,
Yeah.
it can be a really, really good option. And we keep hoping that there's going to be a synthetic meniscus. But so far,
Well, there's a trial that we participated in, and it's still slowly working its way through the FDA, but there's hope. So synthetic meniscus is on the horizon, so we'll hopefully get that in the next few years.